Assalamu alaikum. Today I'll be presenting a study published in JOE 2019 by a group from Lima Linda. The study titled with a retrospective comparison outcome in patients who received both non-surgical root canal treatment and single tooth implant. This paper provides a direct comparison between the survival outcome of non-surgical root canal treatment and single tooth implant by comparing the outcome variable that made within the same patients having both treatment. While non-surgical root canal treatment and dental implant are both highly successful, however, the arguments are often made that one treatment is more predictable than the other. And also, it's difficult to compare the two treatment modalities where the studies are different in the study design, operators, and the patient selection, which made the conclusion are inconsistent. However, the success for non-surgical root canal treatment usually defined by the radiographic changes, while the implant success often defined by the survival of the implant that presented in the patient mouth without any sign of symptoms or implant mobility. So this study used the same outcome measure with more patient-centered measure to compare the outcome of survival, which considered to be asymptomatic tooth or implant that is presented and functioning in the patient's mouth. The study aimed to determine whatever the survival outcome of non-surgical root canal treatment differ from single tooth implant within the same patient, and the study was retrospective, and the data were collected from the patient record at Loma Linda University between 2001 and 2016. At the sample size of 170 patients that met the inclusion criteria of 85 patient male and 85 females. Each included patient had at least one root canal treatment and one single tooth implant, both restored at the same institution with a minimum of 5-year follow-up, with a mean follow-up of around 8 years. The inclusion criteria were patients older than 18 years old, with both treatment completed and restored at the same institution and both located in the matched region, and unrestored teeth or implant or multi-unit restoration such as bridges were excluded. The result showed that both treatment showed a similar survival rate of 95%, with no statistically significant difference between two treatments, and the failure of 9 root canal treatment and 8 implant during the follow-up period, and most of these failures occur in the molar region. Most of the preoperative and postoperative factors did not affect the survival in both groups. However, in root canal treatment, the use of prefabricated post, either metal or fiber, was significantly associated with higher failure rate, while the cast post did not negatively affect the survival. Concluding that within the limitation of retrospective studies, both treatment modalities are highly successful, with the equal long-term survival rate around 95%. And even the survival were the same, implant always come with higher cost and require more additional treatment and time and appointment.